Aging can be rough, and when it comes to women who hit 40, you start seeing changes in your body from head to toe. But then when you go to the 50s, those changes really do kick in with the onslaught of menopause. How to do that?
I like that little kick. That was cute. Things like age spots, lines, even hair growing in places that you never thought you even had hair follicles. Well, our senior producer is finding all of those things out. She just turned 55. She looks great, but she wanted to go to the dermatologist, Dr. Jeanine Downie, for some solutions. Take a look.
We're going to wipe off with just a wet paper towel with water any residual sunblock, makeup. Patients will tell you they've taken off their makeup. They haven't. This is calibrating the laser. This is just making sure that we have it on the wavelength that we need it for her skin type. So it stings. Rebecca is very stoic. I wish all my patients were as good as her. It smells awful. That is a laser targeting the pigment in the hair follicle, because obviously you want the hair targeted, but you do not want the skin targeted. It's a light chemical peel of glycolic acid. It stings a little bit and feels a little zippy. This will help with the texture of Rebecca's skin, the tone. It helps with dark spots significantly, which is why we love it, especially from ingrown hairs. So this one's the Vivite glycolic chemical peel, and this one goes on for about 3 minutes. In addition, many patients in their 40s and 50s can't tolerate some of the harsher chemical peels, so that's why this one's so great. So this is truly a lunchtime peel that you can do on your lunch hour.
Things change so much when you're in your 50s. When it comes to maintenance, what would be your best advice?
My best advice for maintenance is to plan on spending more money on your skin and budgeting for that. Chemical peels 4 times a year. I recommend that people do Botox at least 3 times a year. I like Juvederm every 6 months. Literally use a teaspoon of collagen from your face every year from the time you're 30. Getting a skin check, making sure that your skin is healthy. So come right over here. We're going to have you splash off now. That was long enough for you to sit with the peel on. And now we put on the Vivite Replenishing Hydrating Cream, which is good for post-procedure. And then we put on some MD Forte Aftercare Sunscreen. And then you can go back to work.
Very cool.
Fighting your menopause as we go.
Well, Dr. Downie and Rebecca are here to talk a little bit about maintaining and fixing your skin after you hit the big 50. She survived.
The big 50.
It's written in there. It's written in there.
Yes, this is one of our senior producers, Rebecca, and Dr. Downie, I have to say, watching that piece and even just seeing Rebecca every day, I have to mention before we really dive into this, she doesn't look like a typical 55-year-old.
Right.
No.
Her face looks like a 30-year-old.
Well, she learned from her sins of the past, from the baby oil and the iodine here and here. So, and then you move forward.
Right.
Because the smart women and men learn from their sins of the past, which she did.
Clearly, I haven't learned quite yet, but
Miami this past weekend, shame on you.
I know, but the thing I loved about it was all of those things seemed pretty quick and easy. It wasn't major surgery. This was something she could do on the lunch break.
Right, exactly.
How important is that for women these days?
Okay, well, the bottom line is when you're perimenopausal, Rebecca started complaining to me that she was getting hair here and here and here. And I told her, sadly, that if it wasn't for my laser for hair removal, that I would have a very long, kind of like
Handlebar mustache?
handlebar mustache, really not attractive.
That could be a new
So
look.
then because she was feeling very alone and very isolated, and that's the key. A lot of women feel alone and isolated.
It's like, and then you don't know what to do.
Right. So the bottom line is that we started doing laser hair removal, and we'll show some of that, the laser hair removal in the office, and that really helps to treat it. It's multiple treatment sessions. All this nonsense about 4 treatment sessions and you're done is nonsense. The only way to do it in 4 treatment sessions is if we burn you or if you're very lucky, and obviously we're not trying to burn you.
Exactly. So
Okay.
we're making jokes about
Yeah, I think the mustache would be better than the burn.
Yeah, I was just going to say.
Exactly.
Yeah,
exactly.
pain-wise, because you said that she was a very stoic patient.
She's
Is it
excellent. I'm
normally
not.
hurt?
She's wonderful. She was like, get this done. She's envisioning herself fuzz-free. Because once the hair turns gray, you have no pigment in the hair follicle. And then you're done. You're toast. So you're 85 picking long gray hairs out your chin. Not a pretty sight.
What about, as far as maintenance is concerned, you said that women should budget, you just got to do it. You set aside some money so that you can get these treatments done. How much money are you talking about?
Okay, so it's at least 10 to 13 treatment sessions, then 3 months off, then another 6 treatment sessions, then 6 months off. It depends on what part of the country you're in, and you should see a board-certified dermatologist to get the procedures done. We have a ton of people that come into our office every week I won't say every day, but every week, with really bad burns, like
Problems,
disfiguring burns from these laser clinics with these MAs, medical assistants, or unlicensed individuals doing it. That's all I'm going to say about that.
But you're talking
it's a
about
huge problem.
thousands of dollars.
Thousands of dollars. It's like,
you know,
for what we're doing on Rebecca, it's like, I forget, like $375 per treatment session.
Okay.
But I'm on the lower end compared to some of the other places.
Got it.
And a cheaper alternative, obviously, is waxing and doing kind of those other things.
Right.
But this is going to be more permanent.
Right,
Okay,
exactly,
so
because it's
important.
permanent hair reduction. And then afterwards, you can use like the Vivite line here for post-procedure care. That's really great, especially the replenishing hydrating cream and the sunblock Rebecca liked a lot. And then second, we do the chemical peels all the time because
Yeah,
Rebecca
we
was
saw
noticing
that.
dark marks after she plucked. Maybe she would dig her tweezers in too far and get these dark spots. She was also getting a little bit of redness, a little bit of acne, rosacea. A lot of perimenopausal women get that. She wasn't getting the acne so much as just the redness. But for those, there's prescription medicines. There's Tazarac, there's Phenacia, there's Metrogel, there's Axone. And if you need orals, there's Oratia, which works really, really well. It's a low-dose doxycycline that works great.
All right.
Rebecca, I want to ask really quickly, how did you feel after having these procedures done? Did you notice a big difference?
You know, it felt very refreshed to me. I felt like I looked clearer, and it made me feel better, you know, about myself, about my face. And so to me, it was worth it. And it was worth it for the time that it took. It was like literally 5 minutes I was there.
That was very quick then.
That's good,
I
doesn't
know, I know. Look at her.
I know.
Get a little attitude,
Looking
Rebecca. You
beautiful.
can walk around differently. Yes.
Thank you both, ladies.
Thank you so much. We'll be right back.